Hello, I'm Kinanah Yaseen. I'm going to share this interesting case of a 22-year-old female without any medical history who developed persistent nasal chondritis, which led to saddle nose deformity a few months after getting nasal piercing. Around the same period, she developed erythematous pustular skin lesions in her lower extremities, which was biopsied and was consistent with Sweet syndrome. In addition to her skin rash and chondritis, she reported joint pain and joint swelling. Initial evaluation revealed leukocytosis, normal creatinine, elevated acute phase reactants, and negative autoimmune workup for ANCA-associated vasculitis, rheumatoid arthritis, and SLE. Eventually, she was diagnosed with relapsing polychondritis and was treated with prednisone, methotrexate, and subcutaneous tocilizumab. Few months after receiving treatment, she developed auricular chondritis for the first time and bluish discoloration of her right big toe. Peripheral vascular study of the lower extremities showed abnormal toe brachial index suggestive of stenosis. Echocardiogram was normal, CTA of the chest and abdomen without any large vessel vasculitis, but she tested positive for lupus anticoagulant antibodies. CTA of both legs showed focal wall thickening and inflammatory changes surrounding her right popliteal artery, which may suggest vasculitis. Subsequently, she received pulse steroids, started on infliximab infusion and Lovinox, with immediate relief of her auricular chondritis and normalization of inflammatory markers. Takeaway points of this case: relapsing polychondritis is a rare systemic autoimmune condition that may overlap with long list of disorders, including connective tissue diseases such as SLE, Sjogren, rheumatoid arthritis, spondyloarthritis, and others, malignancies such as myelodysplastic syndrome and lymphoma, and lastly, different forms of systemic vasculitides, including small, medium, large vessel vasculitis, and Behçet disease. Involvement of the aorta and other large arteries such as subclavian, carotid, vertebral, axillary, renal, and iliac arteries are all reported in the literature.